Welcome to our second podcast on the circulatory system. In the first podcast, we went over arteries, and hopefully as you look at this image, you can see the generalized structures that we talked about in that podcast: the tunica intima, endothelium, subendothelial layer, internal elastic lamina; the tunica media, which will consist of our smooth muscle, here you see in cross section, the external elastic lamina, and then our adventitia. Now what we're going to look at today, we're going to look at capillaries, this is the generalized structure, veins, and lymphatics. And one thing I would like to point out in this illustration, what you're looking at in veins, and this will also apply to lymphatic vessels, you can see these unidirectional valves. They're going to have similar shape to our semilunar valves that we've seen in the heart. And so we're going to study the characteristics of capillaries, veins, and lymphatics in this second podcast. Now, we're going to look at three different types of capillaries, so we're going to classify them based on their histological shapes and sizes and constituents. We're also going to look at the different categories of veins, and much like we saw with arteries, we're going to look at the thickness of the layers versus luminal diameter, and then lastly, we will be able to identify lymphatic vessels. Now, capillaries as a general structure are simply going to consist of a single endothelial layer. And the luminal diameter is going to be in the neighborhood of 8 to 10 microns, which is about the diameter of a red blood cell. So these red blood cells are going to pass through a capillary in single file procession, and they're actually going to stack up like coins. It's called the rouleau formation, and that's one way that we'll be able to distinguish what we see as a capillary. But as we look at the endothelial cells that create capillaries, we're going to see that they have different ways of transporting material. One of the ways is pinocytotic vesicles, and pinocytosis literally means cellular drinking. And as we look at these small vesicles, there are a couple of hypotheses about how this actually occurs. First, you can see the vesicle being formed, trapping material, transporting it through the membrane and releasing it to the other side. Or we can have these types of situations where we have these vesicles that are surrounded by a protein called clathrin. And these were identified very early by electron microscopists as clathrin-coated pits. But they surround the vesicles to give it more structural integrity and pass that material through the cell, transport it out the other side. Lastly, as we look at this illustration, we can see vesicular transport almost occurring on both sides. But what we're creating are these tunnels that pass through the membrane to the point that we simply have these pores in the middle of our cytoplasmic portion of our endothelial cell. And these are called fenestrations. We will see them as one type of capillary endothelial cell as we classify our capillaries. Here's some electron microscopic pictures, TEM pictures, and we can see these vesicles, pinocytotic vesicles. In this particular illustration, the author refers to these as a caveolus. Caveolae, remember, we referred to these when we were talking about smooth muscle, the storage compartments of calcium. I prefer to call these pinocytotic vesicles when we refer to endothelial cells. Now, there are no smooth muscle cells that surround these capillaries. And in fact, these capillary endothelial cells, as they form these tubes, they are going to have junctional complexes between one another, and the junctional complexes are going to be in the form of fascia occludens. This is similar to our zonula occludens we talked about with epithelial cells. These are going to be more like sheets rather than ribbons that really form this watertight barrier. Now, beneath the capillary endothelial cells, we will have a thin basement membrane, and if there are any peripheral cells to these endothelial cells, we refer to these as pericytes. These pericytes do in fact have common features of both endothelial cells and smooth muscle cells in the fact that they have contractile proteins within them, and some feel this is one way that we can constrict and dilate capillaries and therefore control the blood flow through the capillary itself. In this scanning electron micrograph, we can see a capillary. These are our endothelial cell, and we have a couple of pericytes wrapping around that endothelium. In our transmission electron micrograph, Again, we see endothelial cell, and the luminal diameter is about the same as we see for a single red blood cell, and we have one cell on the outside. If we look closely at this cell, we would not see dense bodies, therefore we know it's not a smooth muscle cell. But also, when you look at the small diameter of this vessel, it's another way that you can feel confident that you're looking at a capillary and not an arteriole, as we saw in the first podcast. So the first of our three types of capillaries that we're going to categorize are the continuous type. Now, these are located in muscle, connective tissue, nervous tissue. This is your typical capillary you're going to find a most abundant one throughout the body. We're certainly going to have our fascia occludens as we see these junctions between processes of endothelial cells, and as we see them throughout. These small holes represent the pinocytotic vesicles that we have in the plasma membrane of our endothelial cell, and we can see the red blood cell. So about the size of a red blood cell, that is our luminal diameter. Here's our characteristic continuous capillary. Endothelial cells, we have our fascia occludens junctions. We can see one there. There's a junction, possibly one on this end. So one cell layer thick for endothelium, and then surrounding that, we're going to have our pericyte. And again, that luminal diameter is approximately going to be 8 to 10 microns. Here's our scale bar. That's 2 microns. Line that up, get that total distance. So we are approximately in that neighborhood of a capillary. The second type of capillary, these are going to be the fenestrated type. And in our illustration, you can see these patches of very large pores. Now, these pores are going to be continuous from the outside to the inside of our cells. So these channels are going to be made. This is like Swiss cheese now through our endothelial cells. And we're going to find these in the pancreas, intestines associated near endocrine glands. These are going to allow for much greater diffusion of material in and out of the cell. Now, some fenestrations will actually have a very thin membrane across them. However, in other fenestrated type of capillary endothelial cells, such as the ones we find in our kidneys, they will lack the membrane. But most commonly, we will have the thin membrane stretching across the porous openings that we see as part of our fenestrations. Here we can see our fenestrated capillary. We have our endothelial cell, small lumen, and if we look very closely at these thin areas of membrane, we can see what looks like almost pearls strung together on a necklace. We can see these enlarged places that are going to be the cytoplasm of our endothelial cell, and then we see the small strand stretching between. That strand is going to be the membrane stretching across the fenestration. That membrane is only consisting of the phospholipid layer. There essentially is no cytoplasmic component in that area, which gives it the thin membranous type of appearance. Our last capillary are the sinusoidal capillaries, and as you can see, the pores or the holes in our endothelium are huge. There are no membranes with these, and this is going to allow the most rapid access of material in and out of our circulation. And we find these in bone marrow, liver, spleen, lymphoid organs, some endocrine organs, and this is going to also allow for very rapid movement of migratory cells in and out of the circulation. Here we're looking in liver. These are two hepatocytes, one here, here's the other, and our endothelium is going to be lining where the blood is flowing through the liver. And here we can see it almost looks just discontinuous with these large spaces. These are our sinusoidal endothelial cells that line this cavity in the liver. So as we put them together, we can see just our small pinocytotic vesicles that are not continuous outside to in, and you can see just one on this inner face, one out here on this outer face. Here we can see the fenestrated pores as they pass completely through. And then here we can see the large sinusoidal spaces as material can escape. Basically, the only thing that's not going to get out of a sinusoidal capillary are our red blood cells. Now, as we are moving from our arterial supply, so arterioles into our capillaries, we're going to regulate that blood flow. And one of the ways we do that certainly are through our meta-arterioles, and we refer to them as pre-capillary sphincters. However, one way that we can bypass capillary beds, as we saw in physiology with the skin, is arteriovenous anastomoses. So our meta-arterioles in these locations are rapidly going to constrict, causing the blood flow to remain in the major vessel to run directly through the tissue. This is called the thoroughfare channel. And this, therefore, will bypass the capillary bed. Now, meta-arterioles are our precapillary sphincters. They, of course, can constrict and dilate to reduce the blood pressure getting to a capillary bed, as we see here. But if they totally close off, that's going to create the bypass as the blood simply flows through the thoroughfare channel. And I don't necessarily like how they start changing the color, because we're not going to be exchanging oxygen. We're just going to mix. So this should be purple in this color, because we're not going into the capillary bed, and those are the only vessels that allow for exchange. Now, once we leave the capillary bed, now we're moving into the venous system. And so we're going to start small and work back. We started with the large elastic arteries, went into muscular arteries, large muscular, small muscular. We were in arterioles, went past the meta-arterioles or the precapillary sphincters into the capillary beds. Now we're leaving and getting into the first part of the venous system, which are the venules, or the smallest of our veins. Remember, about 2/3 of the blood that's in your body at any one time is going to be in the venous system, because these veins outnumber arteries, and veins are larger in diameter. So with our venules, these are going to be 2 to 3 times the size, the luminal diameter of our capillaries, but they are going to have a single endothelial layer. So when you see the single endothelium, and you may or may not see pericytes, you're going to have to look at that luminal diameter. Now, in some tissues like lymphoid organs, and we'll see these in spleen in particular, in some of these venules, the endothelial cells are going to expand and really bubble into that lumen. And in that case, we call these high endothelial venules. Those cells are almost going to look cuboidal in nature. And this is going to be a location for a lot of diapedesis of these migratory cells in and out of the circulation, and where that occurs. So in this particular case, we are absolutely looking at a venule. You can see basically one endothelial cell layer, and look at the red blood cells. We certainly have a much larger diameter than we have with our 8 microns. So this is going to be a venule. Here we have a couple of smooth muscle cells. It's a fairly large diameter, so we may in fact still refer to this as a venule, or in some instances we may think of this as an arteriole. This is one of those in between. Because of these 2 or so smooth muscle layers, I'm more inclined to call this an arteriole, and this definitely is a venule. Here we can see an illustration of these high endothelial venules. This is a venule. We can see a red blood cell here, and here are the endothelial cells and how they're almost cuboidal shaped. These cells, the fascia occludens, aren't going to be as tightly adhered to one another, and all of these are our white blood cells. I believe the N is representing neutrophils. And these migratory leukocytes are going to be diapedesing in and out of the circulation here at these high endothelial venules. There's another neutrophil. Here's one that is squeezing and diapedesing between. Here's another. Medium veins are the next largest size in our classification of veins, and in this case we're going to be looking at the diameter. So less than 1 centimeter in diameter as we're looking at the vein itself, and we're beginning to see the muscle layers again. We're going to have some elastic lamina. We're going to have loosely packed smooth muscle, but as you can see in this particular illustration, we have a really large luminal diameter. Here you can see some nuclei of white blood cells, and that's going to be just about the size of our red blood cell diameter, so you can get a perspective of the size we're talking about. You can see our smooth muscle layers of the media, But then as you look at the adventitia, here for these medium-sized veins, the adventitia is going to be the thickest of our layers and will help us identify these as medium veins. Now, the large veins, these are going to be the ones that are directly removing blood from the extremities, head, liver, body wall, and bringing it back to the heart. So these are going to be some of our named ones: the vena cava, pulmonary veins, the portal vein, internal jugular, iliac, azygous veins. And with these large veins, we're going to have a very thick subendothelial connective tissue. Adventitia is going to be very, very thick, elastic fibers, collagen, very large number of veins of vasorum. And of course, these are going to be the largest diameter veins that we'll see in the body. So in this particular illustration, here we can see a very collapsed, very long vessel. And again, this is not going to be unlike what we will see with our veins. Here with this diameter, we can see that the middle layer, the tunica media, that is much thicker than the adventitia. Here, the adventitia is the most recognizable. And so this is going to be our large vein. And with many of these, what we're going to see, as I mentioned at the very outset in the illustration, we're going to have these leaflets of valves that are going to be present in these. Once again, we can see that we've got our endothelial layer. I'm not sure we're really seeing much in the way of muscularis. That's probably what we're seeing. And then we've got this large, thick adventitial layer. But whenever you see these leaflets, that's going to let you know, especially with a large collapsed vessel, that you're looking at a large vein. Now, with the lymphatic system, we're also going to see very thin-walled vessels that have valves in them, but we're really not going to see smooth muscles in these. They're going to be similar to the large veins, but we're not going to see anything in the way of smooth muscle. We don't have a blood pressure with these lymphatic vessels very much at all, but they will have the valve leaflets. And as we drain through our pulmonary capillaries, which we will, lymphatic capillaries, as we will really see in our GI tract, these are going to funnel into larger and larger lymphatic vessels until we finally get to the last two that are going to return blood back, this fluid, this lymph, return it back into the circulation. So the right lymphatic duct, it's going to join back into the circulation at the junction between the right internal jugular vein and the right subclavian vein, whereas the thoracic duct is going to join at the junction of the internal jugular vein and the left subclavian vein. So as we look at lymphatic vessels, again, here we can see the leaflets that we have. And so we know that this is either going to be a vein or it's going to be a lymphatic vessel. You can see the very thin-walled nature, which doesn't help a lot. But when you look at the material inside, all you see are white blood cells, no red blood cells whatsoever. That's going to be the big indication you're looking at a lymphatic vessel. And in this illustration, we can see the right lymphatic duct, and then we see the thoracic duct. The right lymphatic duct is largely draining the head, the right side of the body. The thoracic duct is draining the lower portions of body and the left side of the head and the arm.